Hello guys, welcome to 101nursing.com and YouTube channel. My name is Priscilla and today we will be talking about renal transplant. Renal transplant is in the topic under chronic renal failure, stages 3 to 5, probably just 5 because that's when your renals are completely pooped out and they no longer are able to do anything that they are physiologically supposed to do, like excrete waste and maintain a proper acid-base balance. So renal transplant is an option for some people. It's very hard to find um, a renal transplant person, and the list is long, and there are many people that's been on the list for years. And the longer you're on it, the longer you're waiting for a renal transplant, the harder it is, the harder it's going to be for your body to adjust to that organ that's being donated. There's two ways that you can get it: through a live or through a cadaver, which is a dead person or a dead body. And it's donated. It doesn't have to be, obviously, it's not going to be a dead body that's been dead for a long time. That's not going to work. Someone that just recently got into an accident and was an organ donor, they graft the organ, they harvest an organ, and then they place it into a person that has renal failure. And it's really just treating one disease for another, because you're going from renal failure to immunosuppressant, because you have to take a bunch of immunosuppressant medication to keep that organ from being attacked by your own bodies. Um, so that's very, very, very hard, and that's why candidates need to be compliant with their medication. They need to have a really strong history of medication compliance, and they need to be strong candidates, because it's hard to have someone have the opportunity to have their kidney issues reverse, but they waste that opportunity, or they waste that kidney by not taking their medication, and in turn wasting that kidney, if that's even possible to say. But yeah, so counterindications for transplant, as if the person has cardiac failure or chronic respiratory failure, excessive venous vascular diseases, so it's more than one chronic disorder, chronic infection. So someone that's severely ill or just way too ill cannot have, cannot be fit enough to sustain the ups and downs of a kidney transplant. Also, post-surgery, they're going to be on at least 5 or 6 medication. You're going to have your corticosteroid to decrease inflammation. You have your IMRAM, your cytoten, your cyclosporines, various different types of medications that will suppress your immune system and can cause infection to become opportunistic and take over. 3 types of rejection that can occur within chronic renal failure or chronic renal or post-kidney transplant. You have your hyperacute. It's hyper to the acute. It's extra. So just remember that. Hyper. Someone that's hyper is extra. So it's very, 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 very soon abrupt. As soon as they place that kidney in there, there's sharp pain, and there's tenderness, and there's high fever, there's malaise. I love this picture because it just really breaks it down. And then that organ needs to be removed ASAP, as soon as possible, because that can be detrimental to the patient's health. Your second one is going to be your second rejection is going to be acute rejection. And acute rejection happens around 4 days to about 4 months. This picture says 2 years. I'm going to say a few months because it's your acute. But it usually is treated and can be reversible by more immunosuppressant therapy. So you're going to increase those doses or increase the med or give a new med. But you can see an increase in BUN and creatinine, fever, weight gain, decrease urine output. You can have your flank pain, swelling, tenderness at that site. Moving on to your chronic renal rejection. That's good. It's usually an onset. It takes months to years, but you really don't know when it's really going to go bad completely. So supported treatments, basically treating the symptoms. It's difficult to manage. You can have signs and symptoms of proteinuria and hypertension, increased BUN, increased creatinine, and a steady weight gain. But yeah, these are your chronic kidney rejections, transplant signs and symptoms. This is a really cool picture. I love these pictures. It just breaks it down and makes it super simple. Thank you for watching. Have a great day.